Father Gabriel at the door, I, I want to thank all of you of Our Lady of Mount Carmel and also St. John Vianney Chapel for all the contributions that you made towards the clinic project, the maternity and child care clinic project in my home village, Kasingo. We started this in January this year, and we raised, the target was 250,000. In the end, we raised about over 270,000 for the building of this clinic. The great thing also is that the building work went so fast that by the end of June, on the 30th of June, we were able to commission it, and it is in use as I talk. So thank you so much for it. The building work back in Ghana was supervised by one priest from my village, Father Paul Atenga. He's a far younger priest than myself. I've known him since his childhood, and we come from very close to each other. So he supervised it. He did great work, and a lot of the artisans come from the village itself. And so we're able to save quite a bit of money because Father Paul was able to negotiate with them to reduce their charges since it was going to be of benefit to they themselves. So thank God we have been able to finish it and to commission it. It's in use. And as we talk, they have had quite a number of deliveries. The last thing I heard today is that they have had about 11 deliveries. But the first set of deliveries were 3 of them on the same day, all of them boys. So we are proud of this, and we thank God for this gift, and we thank you for all the support that you have given. It's really incredible. Our people were very excited when they saw the inside of that clinic. When I went home for the commissioning of the clinic, 2 people joined me from the parish. Deacon Steve Matz was there, and Mr. Scott Mason were there. I think that for a very authentic witness, it might be useful if you want to have like first-hand information to contact one of these 2 to tell you what they experienced. Because my experience is kind of limited because I was part of it. I come from there, and what they experience will be more authentic than what I experienced. But one thing I know is that it touched them a lot. It touched them a lot. And if any of you was there, you would have been touched by it also. For the fact that this is the contribution that you have made, and it is of great value to people. And you should have just seen the smiles on the people's faces. That was really great. What the chiefs said, what the politicians said, and what the locals said about that clinic being opened there. And another thing is, while it was built mainly for our village community, a lot of people from the surrounding communities are sharing in it, and they are really enjoying it, and they are loving it. I'm told that the first 3 children to be born, all 3 of them were not from our community. They were all from the neighboring communities. It's probably good to know that we started this clinic a bit earlier with only the outpatient department. Now, with what we have built, we now have a maternity ward, a labor ward, a children's ward, and a women's ward, actually. So people who come into the facility for treatment can be admitted. And apart from putting up the structure, a lot of things have also gone into it. Your contributions went a long way because we're able to buy really not relatively, new and up-to-date hospital beds that can be cranked and all that. They are there. So all the hospital beds. And then we have the smaller beds for the kids and the newborn babies as well. And in each of them, like the labor ward, the requisite equipment for helping women to deliver safely, hygienically, everything is installed in it, and it is far outweigh. I mean, it's more than a lot of hospitals that are there in the country now. And then also, we now have an operations room which has some equipment but which cannot be put to use now for some other reasons. And the reason is very simple, that there is no doctor appointed to the place yet. And the doctor is not being appointed because he has no living quarters. Anyway, then there is a more equipped laboratory for lab tests, blood tests, stool tests, and all those things that are necessary for diagnosis. So all these things, there's a much better system now, and other hospital equipments that are helping for antenatal care and then post birth, when they come back for vaccinations, when they come back for weighing to check on the children. All these things have now been provided, which were absent at the beginning. So one thing that is very clear to us is that that health facility now is a very good place that a lot of people are are already coming into for treatment. If you remember when I made the presentation for the fundraising, I mentioned the fact that this was necessary because our people had to travel long distances and on very bad roads to the nearest hospital. And the two people that went with me would bear witness to that, because sometimes when I was driving them around, they got frightened. They thought that we might be getting an accident. They thought I was too fast at certain times, but it's just because I'm more used to those roads. That sometimes caused babies to, mothers to lose their babies, even on their way, because of the shaking and because of the delay. Sometimes some mothers even lost their lives because they were bleeding too much and there was no help. And so there was that whole problem of loss of lives. And because also of the distance, some of the families that did not have the means in terms of financial, to go to the bigger hospitals, found it difficult to go. And there were people who died in some ways that were not necessary. They could have survived if they were to get into a health facility. And then the other thing is, sometimes somebody is sick and needs to be sustained before being referred to a bigger hospital for health support. That was lacking in our place. And so there would have been people who died just because they didn't have the chance to even go into any facility to get help. Now, with the facility in our midst, right close to the people, the money that they would normally need to transport themselves to go to a faraway place is no longer necessary to do that. So it's easier for them to reach out to this facility. Then secondly, with the kind of equipment that we have in the facility, it makes things easier. It's one of the testimonies of the nurses and then the physician assistant who is working there now. It's one of their testimonies that they said, because of the equipment they have now, health delivery is far easier now and more safe for them. And of course, then the nurses are encouraged to work a lot more because they have this equipment. And then also, even the atmosphere itself is good, very conducive for them to work. They have the space now to work, so they are happy about that. So this is a life saving facility. So the contributions that you have made, it is not just so that people will have things easier, it's a life-saving facility. This you should know in order to be able to see how big your contribution is. And remember, whatever amount you put into it is very much appreciated. I mean, when you look at the fact that the facility that we have been able to put up with 270,000 US dollars together with the equipment, you will know that whatever you give goes a longer way to serve and help our people out there in Ghana. So thank you, and thank you again. God bless you.